All right, y'all, we'll get started. Please take your seats for the final component of today's gathering. I love the pictures. I love the conversations. Don't forget to post the pictures. The next part, we're going to focus on partnerships and what we get out of working together to advance a common cause. Here in the department, we believe strongly that we can improve access, improve affordability, and also break down structural barriers when we work together. Before we get started with this component of the summit, I'd like to bring back Secretary Javier Becerra. All right. Secretary's in position. I'm honored to announce 4 new public-private partnerships that HHS is launching to promote the health and well-being of Latino individuals and communities. Each of these partnerships have their own unique attributes and activities, but share a common goal of working collaboratively to ensure the equal access to health and human services. First, I'd like to welcome Dr. Elena Rios to the stage. Dr. Rios is the president and CEO of the National Hispanic Medical Association. The association represents the interests of 50,000 licensed Hispanic physicians in the United States and is dedicated to empowering Hispanic physicians, healthcare associates, residents, and medical students to be leaders who will help eliminate health disparities and improve the health of Hispanics. Thank you, Dr. Rios. Next, I'd like to welcome Dr. Cynthia Lebron, President of the Latino Caucus for Public Health. The caucus aims to play a pivotal role in research, policy development, advocacy to address the health issues that impact Latinos throughout the Americas. I'm also delighted to announce our partnership with the National Latinx Psychological Association. Its members' goal is to see a physical, do we have a representative? I'm just going to still announce them and say that they are a membership organization whose goal is to improve the physical, psychological, and social environment for Latinx in the United States. So they're our partner now. And now I'm delighted to announce 11 commitments that have been made by our colleagues in the private sector. These commitments include diversifying and expanding the Hispanic Latino healthcare workforce, improving access to healthcare coverage, prioritizing equitable healthcare for the Latino community, and supporting mental health. First, let me welcome Paola Gonzalez to the stage. Paola Gonzalez is the president of the Physicians Associates for Latino Health. They will launch a new mentorship program that will combine on-demand webinars with monthly meetings and one-on-one appointments to help increase diversity within the Latino healthcare workforce. Thank you, Paola. Next, we have Dr. David Mendez, the Chief of Staff and Special Assistant to the President of the Hispanic Association of Colleges and Universities, or HACU. HACU will develop a research agenda among members of Hispanic Serving Institution, or HSIs. They are also not with us today, but we will just still wanted to acknowledge them. Now let me welcome Yvonne Rodriguez, the founder of Egality Science. Egality Sciences will partner with mental health clinicians that are interested in providing clinical research in their community practice in order to expand access to care as an option to those in need. Great. Next is the president of the National Latino Behavioral Health Association. The National Latino Behavioral Health Association will train community-based organizations on effective outreach and enrollment strategies to access healthcare coverage. Next is Nathan Barrera Bunch, representing the Sigma Lambda Beta fraternity, the largest historically Latino multicultural fraternity in the United States. Sigma Lambda Beta has created the Multicultural Leaders Program, a first-of-its-kind program to help Latino communities improve gender equity and promote reproductive health and choice. Next, we have Unidos US. Rita Carreon. Unidos is announcing a robust commitment to actively engage with their national affiliate network, multi-sector partners, federal and state agencies, and policymakers to address mental health needs. Now we are joined by Al Cardenas, representing Vital LLC. Vital is committed to addressing persistent healthcare disparities in the Hispanic community through their federally compliant health plan designs. Now let me welcome Marta Sanchez, Director of Health Policy and Advocacy of the Young Invincibles. Young Invincibles has committed to create a new supplemental open enrollment materials and health literacy resources that are inclusive of Latina DACA recipients who may be for the first time eligible for Medicaid and ACA plans. We are also joined by Juan Roberto Madrid of Green Latinos. Green Latinos will support mental health needs and prioritize healthcare in the Latinx community through their grassroots grant making for tree canopy restoration across Latinx communities program. And then next we have Adriana Nava, President of the National Association of Hispanic Nurses Association. The National Association of Hispanic Nurses will work to support the mental health needs of Hispanic nurses and the Latino community by prioritizing mental health awareness and community programming by working with partners to offer discounted or at least 3 free therapy counseling sessions on a yearly basis. So those are all our partners. We have one more, Salud America, who is not here as well, but just want to acknowledge them. Secretary, I'll give you the podium as you walk out, and then I'll have some closing remarks.
So we shook hands, so they are committed for life. And if we can keep the government open, we'll follow through with them as well. So just to each and every one of you, mark it on your calendar. We got to do this again. And that will be the annual summit, I hope. But we'll be seeing each other more on other occasions. When you have some particular work or we have a need for your assistance, we'll get together. But every year, when we come together to celebrate la cultura, los logros, all the things that make us proud of who we are as Americans in this great country and the background we bring, let's be ready. Because like my dad said, the next morning we got to get up and we got to go to work. And it's got to be a good day. So thank you all very, very much.
All right, y'all, that concludes our program. You all have been an incredible audience. I hope you were able to take what information shared today and bring it back to the communities. I think oftentimes in these jobs, you think about wanting to leave something that is lasting. And for me, the thing that I hope that we can continue moving forward with is the partnerships, the conversations that we had today, the future co-conspirators and this equity work. So continue to be able to engage one another, continue to get to know one another for future partnerships. You will see the different tables already established. Those are our resource tables. We have the Administration for Children and Families present, Centers for Medicare and Medicaid Services, Health Resources and Services Administration, Office of Minority Health, Substance Abuse and Mental Health Services Administration, Agency for Health Research and Quality, U.S. Department of Agriculture, U.S. Department of Housing and Development, U.S. Department of Justice, Office of Violence Against Women. So we're bringing on resources here. Please take advantage, but also know this is not the only time we're going to do it. So we're looking forward to future partnerships. Have a great day.
Produced by the U.S. Department of Health and Human Services.